Let's talk about mental health people. So the field, let's start with the medical field first. So in the general medical field, we've done a really good job of kind of delineating who is who. So if I said, "Hey, what's the difference between an orthopedist and a neurosurgeon?" Most people go, "Oh, a neurosurgeon works on your brain, and an orthopedist works on your bones." Correct. Um, if I said, "What's the difference between a DO and an MD?" Most people would say, "Oh, well, they're both doctors." Yeah, and that's correct. Both of them are medical doctors. Well, in the world of mental health, there's a lot of different people. So there are psychiatrists, and what psychiatrists? That's what I do. I went to medical school, so I did 4 years of medical school, and after 4 years of medical school, I did 5 years of training to do this particular type of psychiatry. But most psychiatrists, if you're going to work with adults, most psychiatrists do that in 4 years. And if you work with kids, it's 5 years. Okay. And so that's what a psychiatrist is. It's a MD or DO that does specialized training over the course of 4 to 5 years after medical school. So, all total, we're in with 4 years of college, 4 years of medical school, and then 5 years, 4 to 5 years. So what is that? 12 to 13 years of training. So that's what a psychiatrist does, so that we can prescribe medications safely and do some kind of basic therapy. Alrighty, so that's a psychiatrist. A psychologist is someone who does 4 years of college, and then they do 3 to 6 years of graduate school. And so by the time they're done, it's 4 plus 3 is 7. So 7 to 10 years total, where they become really big experts in your brain, how it works, therapeutic processes, assessment, meaning they can do things to figure out what's going on and evaluate you and help you feel better. So that's a psychologist. And in most states, psychologists mainly do that. They don't prescribe medicines. There are a few states where psychologists can prescribe medicines, but that's, again, it's not very common. And so you'll know you're talking to a psychologist because they'll have the initials PhD or PsyD, PSY.D. And those are kind of your big psychologists. Now, here's the caveat: there are other psychologists. So you can have a master's level psychologist. So one is called a LSSP, so licensed specialist in school psychology. And technically, they are psychologists. They do 4 years of undergraduate, and then they do, I want to say, it's 2 to 4 years of a master's program, depending on what they're up to. But they can be also called psychologists, or you can get a master's, an MA, Master's of the Arts or Master of Science, and then specialize in like childhood development. Those people are also can be listed as child psychologists. So it just kind of depends, honestly, partly on state. But for all intents and purposes, when I talk psychologists, most times I'm talking about the PhDs and the PsyDs. Yeah, and then the difference between a PhD and a PsyD, and this is where I get in trouble. PhDs do a full dissertation, so they have to come up with a question and they build all this stuff on top of it that's kind of complicated and lots of research. And whereas PsyDs do more of a clinical approach, so they'll answer clinical questions without doing a full dissertation, as I understand it. If you're a psychologist, please correct me. Send me a message, or you can put it in the chat. Alrighty, so we talked about psychiatrists, we talked about psychologists. There are a couple other medical folks in the mental health realm, so physician assistants, so PAs, and then NPs, so nurse practitioners. So NPs and PAs, they both also complete master's level programming. So physician assistants, they do 4 years of undergrad, and then they do 2 years of a master's program. And then for nurse practitioners, they do their nursing program, which can be 2 to 4 years. And then they'll do basically a master's program, 1 to 3 years, depending on what they're up to, what they're doing. Okay, and then all of those physician assistants and nurse practitioners can also prescribe medications. So Other people in the mental health world. So next up is LCSW, so licensed clinical social workers. So licensed clinical social workers are people who most of them have a social work degree, so they do 4 years of that, and then they go to do a master's program, which can be 1 to 2 years plus 3,000 hours of clinical care. So they're actually working with patients over 3,000 hours and being supervised by an LCSWS, which is an LCSW supervisor. Somebody is specifically trained to supervise those folks getting their licensure. So that's an LCSW. A lot of folks will call them social workers. In general, I just call them therapists. Not all social workers are therapists. So if you have questions about that, just ask them, right? So as LCSWs, and they do all sorts of things. I mean, they do therapy, but they subspecialize in lots of different areas: talk therapy, family systems therapy, psychedelics, you name it. They get to do all sorts of things. So those are LCSWs. Next up is LPC, so licensed professional counselor. So LPCs. These folks, 4 years of undergrad. So in other words, go to college. If you want to do any of these things, just do your 4 years in any undergraduate institution, and then you do a master's program, 1 to 3 years of a master's program plus another 3,000 hours. Very similar to clinical social workers, but it depends on the degrees that you had before you applied to the master's program. They also can do all sorts of things. So sometimes they, will do equine therapy. They do lots of different genres and types of therapies. So next up is LMFT, so licensed marriage and family therapists. And what LMFTs do, again, 4 years of undergrad, and then they do their master's program in marriage and family therapy, and they work a lot in systems. So systems meaning how one person relates to the other person. And they also have a clinical hours requirement, so they have to do up to 3,000 hours and to get their licensure in the whole 9 yards. And so I'm trying to make sure. I think those are all of those. There are school psychologists, not school psychologists, excuse me, school counselors. So LPC, even though LPC is a licensed professional counselor, there's a subset of school counselors where, in order to be a school counselor, you have to have your teaching certificate, and then you go and do a master's program in professional counseling. So those are school psychologists. Um, it feels like I'm probably missing somebody, but those are all the big ones that I can think of. And so, as you can imagine, when you have a workforce that is this diverse, that has this many licensures and certifications and all this kind of stuff, it can get real confusing really fast. And so, the key is no matter where you start, so whoever you talk to and whatever initials are after their name, the key is just ask them what they do, and if they can't help you, ask them to refer you to someone else because they tend to know each other. So, as a psychiatrist, I know lots of counselors and therapists, and so yeah, and vice versa. When I use the word therapist, I'm encompassing everybody. So I'm encompassing all of these different things. If I say social worker, I'm mainly only encompassing social workers. If I say psychologist, I'm I'm encapsulating the psychologist as I defined them earlier. So the key is just ask the question. There's other folks. Oh, you know what? I forgot BCBAs. B as in board certified. So board certified behavioral analysts. So BCBAs. These folks do college, so undergrad, and then they do a master's program to learn how to best interact with folks who are having behavioral struggles. And so BCBAs are awesome. They are very popular, and I would say popular. There's lots of them who work with kiddos and adults with autism and intellectual disabilities. So those are BCBAs. And again, I'm trying to think because there may be other ones that fall from the sky and fall into my brain. But before we finish this part of the office hours, but overall, These are all the people that comprise the workforce. All of them have their own strengths. The key is getting all of us to work together. That can be sometimes difficult because each one of us has our specialty. Also, insurances and pay your sources, like how they're paid for, can vary greatly, and so that's another cause for angst and frustration for most folks because yeah, it's just a very big hodgepodge. Those are all things that I like to talk about when it comes to healthcare finance. So Google me, check out my book because I write a whole lot about that stuff on my personal website. So alrighty. So those are the big differences between all the mental health people. Shout out to all of the folks who make all of this stuff possible. So all of our receptionists, our front desk folks, our back office folks, our behavioral techs in hospitals who help people get to where they need to go. All of our program specialists and the folks who are just kind of ancillary staff to that make it possible to do what we do. So shout out to them. Thanks for all your hard work. All right.